Smartphone use in children and young people is becoming a highly researched topic. Whether smartphones cause poor mental health or whether poor mental health causes smartphone use problems is being explored. In 2019, a group of researchers led by Sion Son from King's College London did a pioneering global study on children and young people. They wanted to study how many people had smartphone use problems, which is also called problematic smartphone use. Over the last 10 years, the number of people using smartphones and the amount of time people spend using their smartphones has increased. Children and young people are also using smartphones at a younger age. Some people show problems with excessive smartphone use. These people can show similar signs to other behavior addictions, like anxiety, if they are apart from their phone or their battery is running low. They think a lot about their phone and sometimes cannot stop using it, even though it hurts their mental health. These behaviors can be signs of what is called problematic smartphone use. The research team wanted to learn about problematic smartphone use in children and young people between 2011 and 2017. They wanted to know how many people use their smartphones so much it was considered a problem during those years. This is also known as the prevalence of people with problematic smartphone use. They wanted to know which groups of people have smartphone use problems. Also, if there is a link between problematic smartphone use and poor mental health. Learning about this could help us discover how to prevent it. It can also help develop treatment for people with these conditions in the future. The mental health problems they were interested in were anxiety, depression, stress, poor sleep, and lower academic achievements. The research team collected data on children and young people who were an average age of 25 years or younger. They wanted to learn which genders were more affected by smartphone use problems. They also wanted to understand which different age groups were most affected. This was also the first team to do research gathering this information about people from all over the world. So how did Son and the team do this? The researchers looked through 8 science and health databases, gathering studies using words like smartphone, child, and addiction, and similar words. This is called a systematic review. They found 924 studies about children and young people with problematic smartphone use. They picked 41 to analyze because those studies match what they were looking for. For example, the children and young people were the right age, they were using the right electronic devices frequently enough, and the research was done at the correct time. The researchers assessed and tested all 41 papers to ensure the methods used for the studies were of good enough quality to be included. They used the results of 41,871 children and young people from the studies. Then they analysed all the results from all 41 papers together to learn more, which is called a meta-analysis. So what did they discover after the meta-analysis? Let's find out. The results showed that an average of 23%, or approximately 1 in 4 children and young people, had problematic smartphone use. The most affected groups were females, who made up 55% of the people included in the research. Children and young people aged 17 to 19 were also the most affected. The researchers found a consistent connection between problematic smartphone use and poor mental health. The results showed that they would be more likely to have depression, anxiety, and stress, as well as poor sleep and lower academic achievements. What were people with smartphone use problems doing when they were on their phones? The most frequent use of their smartphone was for communicating. They were using social media, which was important to them, and they were watching TV. So what were the limitations of the research? Directly comparing lots of different research is challenging. There were 24 different questionnaires used for diagnosing smartphone use problems, which made comparing the results difficult. The mental health results relied on the children and young people reporting them themselves. Therefore, there may be differences in these results. After all, different people think about stress and depression in different ways at different levels. Many of the research papers were different in their methods, making them difficult to compare accurately. Although there are limitations, the research does show us what we can do better in the future for more accurate results. The data also showed a consistent link between problematic smartphone use and poor mental health. What can researchers do differently in the future to get better results? If the same questionnaires for diagnosing smartphone use problems were used, this would help with consistent results. Medical or other professional people diagnosing the mental health of the children and young people instead of them reporting these themselves would also help give consistent results. So does this study tell us problematic smartphone use causes poor mental health, or poor mental health causes more smartphone use problems? This research study does not answer that question. It only tells us there's a link between them. This could be another topic for research in the future. Understanding the use of smartphones and addressing problems with their use through this study and future research can help us identify high-risk groups early. We can better understand how this links to poor mental health outcomes. Then we could give education to prevent this, and the number of people affected could be reduced. This also helps provide earlier treatment, ensuring quick and effective help is available when it matters the most.